Hi, my name is Jenny Hatch. I am a hemodialysis nurse. I've worked in hemodialysis for approximately 26 years. I have been a nurse for a year now, and I'm excited to have a bachelor's degree in nursing. The biggest influence in my life has been, number one, my father. He was a single dad raising 5 kids, and he was very inspirational to me. A couple other big influences in my life have been the nurses I work with. They are the ones who have inspired me to go to nursing school to get a degree at age 45 and just continue to grow, gain an education, and learn. And I've really appreciated that. I was married for over 20 years and got divorced, and I was single for a couple years, and I recently got married 2 months ago. Very happy, super loving that life. I have 4 children, 2 of whom are married. So I have 2 son-in-laws, and so far I don't have any grandkids, but I really, really want grandkids. So that's kind of my bucket list, is just to spend a wonderful life with lots of children, grandchildren all around forever. I have no real other desires in life other than to just be with my family forever. I have read and understand the course syllabus, and now I would like to describe my project to you. So working in hemodialysis, there's many opportunities for growth. And I recently just took a position in the home hemodialysis department, and I teach patients to do dialysis at home. We have a machine that we install, and we use their water and their plumbing for water and drain, and patients learn how to self-cannulate on the floor. So they put their own needles in. They basically take care of themselves all throughout this treatment. We do like our home hemo patients to have a care partner, and we actually require that they have a partner. We are venturing slowly into thinking about solo dialysis. If someone can show us, prove that they can do it by themselves, then we are going to give them the chance to do solo. We're also thinking about branching into nocturnal dialysis, and both of these are new adventures for my company. And even home dialysis is newer for my company. We only have 12 home hemodialysis patients. We have 26 peritoneal dialysis patients. And so I'm in charge of the home dialysis, and we do not have a training program for our nurses to use when they train new patients. And so what I would like to do is develop a program that the nurses can use to follow every day while they're training patients on how to care for themselves in home dialysis. So what I mean when I say we don't have a training program, we have a 3-week training program, but nothing is written, nothing is down on paper. There's no guidelines. There's no direction as far as what you need to teach. You just kind of have it in your head and zoom through things and hope that you catch everything, but a lot of times things can get missed. And so I would really like to develop a 3-week training program that is written where every day counts. Something is taught, and educational material is given, presented, whether it's through video form, through our company, which is called Next Stage. That's the company that we use for our machines. And they do have training material out there, but there's no program that we follow that our patients can use. So I would like to use, for the materials that I would like to use, it would be the Next Stage. A lot of it will be Next Stage training materials, but I need to go through that and separate what is important, what is pertinent to our program, and what things what policies or do I need to incorporate for our program. My timeline is going to go as follows. The first week, which I'll start May 24th, will be brainstorming. I'm going to brainstorm with my partner who is brand new to home dialysis, and we're going to come up with all the things that we need to teach as nurses to our patients. And then the following week, May 31st, we're going to draw up an outline of this program. and the way that we want things to go for this 3-week training program. By June 7th, I hope to have our outline finalized. June 14th, we will begin researching the best practice, especially for solo dialysis and nocturnal dialysis. June 21st, I will present the educational material to my mentor with my partner. June 28th, we will write up. By June 28th, we will have written up a training program. July 5th, we will present this training program to management, and I will have everything finalized and done by July 12th, when I will present this training program to the nursing staff. So I already discussed materials. How I will present this project to a target audience is I will present, first of all, to management to get approval for this project, and then I will present to the actual nursing staff who we will be training. A few of the things that we want to teach in our training program are clean, dirty, and sterile. That would be the first thing that we would teach, so that our patients will understand the difference between things that need to be just kept clean and connections mostly that need to be kept sterile. We will teach the components of the dialysis machine. We will then schedule the install for their machine, schedule the welcome call so that their supplies can get delivered on time. We need 10 business days for that, and when you're only training for 3 weeks, every day counts. A couple other things we're going to teach are about the alarms on the machine, troubleshooting alarms, emergency procedures, and how to deal with complications when they arise. We're going to teach the patients how to draw cultures from what's called the sack and the pack. The pack is the purified RO water. So our machine hooks up to their kitchen sink, their bathroom sink, and the water gets purified through the pack. We have to draw cultures on the pack once a year, and by the time the next year comes around, the patients forget how they need to draw these cultures. And so we are going to come up with training material that they can have at home to draw cultures from the pack. And then the sack is their dialysate, and in dialysis, the blood goes on one side of the dialysate goes on the other side of the dialyzer, and that's how dialysis happens. That's how the blood's cleaned, is the dialysate goes across the blood side and pulls out the toxins from the blood and the urea. And so we have to culture the dialysate, this sac. We have to culture it once every 3 months. So we need to come up with a way to train the patient how to draw these sac cultures, because they're at home and they need to learn how to do this themselves. We also need to teach the patients about nutrition and the differences between being in center and how dialyzing only 3 days a week completely differs from dialyzing 5 days a week, and having better clearances and having a little bit more freedom with their nutrition. The last thing is medications. So when you dialyze 5 days a week, you are able to reduce your blood pressure medications. And so giving the patient some training, educational material about what to watch for as far as their blood pressure when they are on dialysis is really important, because they get home and their blood pressure is going to decrease because they're getting better dialysis, and there's going to be a need for them to reach out to their doctor, the home dialysis team, to get their blood pressure meds reduced so that they don't have hypotensive episodes. So these are some of the things that we need to teach in this training program. So these are some of the things that I'm going to research, try to find best practice, so that my material can be the most current, up-to-date information possible for our patients. So how will I assess the effectiveness of this program? So I am going to use the other nurses that I'm going to present to as a way to assess effectiveness. I'm going to have a questionnaire after I present to them that will help them, that they can use to rate and give me feedback of things that I can improve, maybe concepts that they didn't quite understand that I was trying to teach, things that I need to be a little more clear with. And then I'll be able to revise and revamp the program, but I need to get the program written up, and then I will present it to management, get approval to present to the nurses, and the nurses' feedback tool that I will give them will be the best way that I can assess the effectiveness. If the nurses understand what my program is trying to teach them, then they'll be able to teach the patient more effectively. So hopefully all will go well and this project will turn out great, and we will have a way that we can train the patients, make every day count, present educational material, and be able to use this program to teach the patients how to do dialysis at home. Thank you for your time.